My name is Aster Low. I am the moderator for today's session. So I have with me today Dr. Yun on the left. She's a pediatrician and also a subspecialty in neonatology. So what that means is that she has vast experience in treating pediatric conditions, especially in newborn babies and also including premature babies as well. Then next to Dr. Yun, we have Dr. Chiah Cheun Hui. He's a general pediatrician and he has more than 20 years of experience in treating all sorts of pediatric conditions. And to the leftmost, my leftmost, we have Dr. Wei Loon. I believe many of you have met him this morning when he gave the talk about screens. So Dr. Wei Loon is an ophthalmologist with special interest in pediatric ophthalmology. So his experience includes ophthalmology research, and he can treat conditions in both adults and children. So first topic, immunization, very common. Basically now I think probably many parents understand that vaccination is very important because it's probably one of the most effective ways in preventing illnesses and diseases. But we can see, throughout this time that there has been also some changes and also some additions. Compared to past, maybe we don't have so many vaccines in our vaccine schedule. But now you see actually there's a lot, and then you always repeatedly have to go and see a doctor for vaccinations. So I think a common question amongst parents is that are all these vaccinations actually necessary, or can some be skipped? So this first question I will direct to Dr. Yun.
Good morning. So for Aster, the first question is whether all I think we know the best way that we immunize our children is through the vaccination. So whether the vaccination that recommended in the market for the children are all necessary. So my answer would be yes. So don't skip the vaccination that recommended especially for those like in our national program. So if you follow the national program in your pink book in the blue book, there are I think there are 12 vaccine which is compulsory in our in Malaysia. So that one you cannot miss. And the other recommended vaccine, I think there will be another 5, including your chickenpox, your JE hepatitis, and also the meningococcal. That one is also is advisable to skip because that one is also important to protect the children from all these infectious diseases.
That's great, Dr. Ng. I'm wondering whether perhaps Dr. Chiah, you want to add anything to Dr. Ng in terms of vaccinations in children?
Actually, good morning. Thank you for having me here. No, usually I just like to share practical things. You can read up everything on the internet anyway. But I always share with the parents, 20 years ago, 30 years ago, you see polio. I have pediatric colleague who walk with a limp. They have polio disease when they are young. Do you see polio now eradicated in Malaysia? No more. So that's all due to vaccination. Then, to further answer the thing, chickenpox. Many old people would like to say, oh, why you want to vaccinate? You get chickenpox, it's better. Why you want to vaccinate and prevent chickenpox? But not true. Chickenpox vaccine only in the 1980s was just developed. How would the old people know you get chickenpox better and vaccination, is not so superior? So when pregnant lady gets chickenpox infection, if they are not vaccinated, it's a disaster to the baby. Dr. Ng can tell you. Then, when you're old, you get chickenpox when you're old, it's also very dangerous. So in general, for most people, vaccination is a good thing.
And I would like to add on that the vaccination that for children in the market now is actually quite safe. Most of the vaccine that recommended for children, actually they have been in the market introduced for more than 20 years. Like for example, your BCG, that we given at birth actually have been introduced in 1950, and MMR is in 1970. So they are quite safe and just go ahead. Because when I still remember when I work in government hospital, we encounter a lot of parents, what we call them as a vaccine hesitancy, or they are reluctant to vaccinate their children. So there are many misbeliefs that we need to address to them. First, and we can see such group of people actually, parents actually, they are getting more and more. So some of these infectious disease actually have been researched, have been reappeared in the community only. So for example, diphtheria, pertussis, actually the disease that we not encounter 10 years ago, because at the time the community are fully vaccinated. Now we are seeing more and more cases because of this. Some of the parents, they are reluctant or refuse to vaccinate the children, and I would say these diseases actually can cause high morbidity, and sometimes can cause death to the children. So if you ask me, vaccination is the best way to invest for the children's health.
So wonderful. We actually got a very insightful input from both Dr. Ng as well as Dr. Chiah. So there was also a mention in terms of vaccination, it's not just important for your child actually, it's also important for the community. So if you hear, when certain people start to not take their vaccines, and then later on these people, they are exposed to the particular virus or whatsoever, then sometimes they get it later, okay, at older age group. But what happens because once these diseases start to appear, and then we have very young children who have not yet received the vaccine. So then it's also detrimental for them, for these young children. So it's really, really important to get vaccinated for yourself, for your children, as well as for the community. So thank you very much, Dr. Ng. We'll move on to the next topic. Common diseases. So probably this part I will focus more on maybe older age group lah. So for children, once they start to go to school, they start to first kindy lah, then after that school, then you see them, they will catch all these different sort of illnesses, and then they come back home, and then sometimes you're not sure, okay, this one I need to bring the doctor or not, or this one I can read it out. So I'm gonna ask this question to Dr. Chiah. What are the common diseases or illnesses amongst probably the age group between 5 and 10? And what are the key or very important symptoms, or when should a parent worry?
I think right off is respiratory illness, cough and cold. Cough and cold, so many common things like influenza, your upper respiratory tract infection. So basically cough and cold. Then when you start going to school, of course, the school, it spread a lot of diseases, hand, foot, mouth disease, diarrhea diseases. We call it stomach flu. I think these are all the common things. Then viral fever, of course, viral fever. Okay, when you should get worried, very difficult to answer. There are so many things. We call it red flags. There are so many red flags in pediatric. I always tell the parents, number one, if you don't feel comfortable, you know your child best. Whenever the child look different, you don't feel comfortable, anytime you are worried, see a doctor. Because you will know best, because they really behave differently. Even though the temperature may be 38, but they are tired, they look different, see a doctor. But how to say, I don't think I can finish saying every single red flags, but anything that you are worried. I think, yeah, you want to add anything?
Like what Chiah say, what you concern. So I think one is a high fever. So how high is high? So probably the fever. Okay, if the child is relatively well, high fever, 39, 40, I think you should see a doctor. Or anytime that the child appears unwell, tired, refuse to eat, refuse to drink, and not her usual self, not active, not playful, so become more quiet, tired. So you need to bring for the immediate medical attention.
Thank you very much, Dr. Chiah and Sir, for the overview. So basically, for common diseases, like it's mentioned over here, usually the cough and colds, occasionally the stomach bugs as well. But if your kid is running around, can still eat, can still laugh, can still play, sometimes we say that that's okay, right? Wait it out maybe 1-2 days, but if after that it's still prolonged, I think better also to always seek a professional opinion from your doctor. And then the other thing that was mentioned just now is actually as a parent, and myself also as a parent, sometimes we actually have to trust our instincts. So if we think that, even though it's a bit, but you're not certain or you're not sure, always seek an opinion from your doctor or the pediatrician. Okay, so we'll move on to the next topic. So actually a bit related. It's talking about fever. So that's very confusing, we feel like touch warm, but then need to check temperature or not. Or what temperature, is defining what is a so-called simple fever or more severe fever. So again, I think I will ask Dr. Chiah to share for let's say a fever that's maybe 5 years and above like that. What are the concerning sort of fever?
Okay, fever, usually I would say low grade when you are below 38. Then for us, any fever that is significant is probably 38 and above. Then when you are talking about 39, 40, it's very high fever. Okay, then having said that, like what Dr. Ng said just now also, if the child is running around, playing, with the temperature of 39, probably there's nothing to worry. But if the temperature is 38.1, but the child look tired, lying down all the time, not responding to you, that's not good. Then you probably have to come. But any fever is a body defense mechanism to fight infection. So probably you may have to bring to see a doctor if the temperature is very high. Then in general, I tell parents if the fever more than 2 to 3 days without any cause, that means you don't know what's the reason. There's no cough, there's no flu, no vomiting, no diarrhea, anything more than 3 days, even though the child is well, probably you should see a doctor. Then anytime the temperature very high, probably you have to bring. Then when the child is not well, lethargic and things like that, tired, please bring and see a doctor.
So that's great. Basically, fever, as Dr. Chiah mentioned, is actually the body's mechanism to actually fight the infection. But sometimes if it's too many days, too long, or too high, definitely you have to bring to see a doctor. So, Dr. Yun, for let's say younger children, especially the babies or maybe children under 5 years old, is there anything to add to this, or are there any specific concerns in this in fever in this young age group?
Okay, so I think fever less than 2 months old, I think for me, with no obvious cause, you have to, there will be always, is a worry. Less than 2 months old, is the baby got fever, better bring to see a doctor before giving any medicine. Because for after 2 or 3 years, 2 or 3 months old, it got fever. Usually, there could be many of causes, can be viral causes, can be bacterial causes, and if the baby is well, so for example, the fever is not high grade, baby still remain active, I think we still can watch and see for about 24 to 48 hours first. And I wanted to share the anti-fever medication. So the fever medication in the market, we have only two. One is the paracetamol, another one is the ibuprofen. So we always advise if got fever, give paracetamol, not to give ibuprofen, because especially if you cannot exclude certain diseases, for example, influenza, chickenpox, because I think there are cases that ibuprofen given to this kind of children or small infant, they are associated with some certain complication. So if got fever, my best advice is to feed paracetamol first rather than ibuprofen.
That's great. So basically, in young children or babies, you have to be even more concerned. Don't try to self-treat. And then as well as a very good input about the medication, which is paracetamol or what we call ibuprofen. And even sometimes if you just go to the pharmacy, sometimes you just ask, you want to buy the suppository, that one. So, pharmacy, sometimes they will just sell it to you. And actually, for young children in particular, it's not advisable. One, the dose cannot be controlled because it's a very fixed dosage. So it's not actually to their body weight because children, the dosing of everything goes by body weight. And furthermore, as Dr. Ng has really perfectly explained, for ibuprofen, actually, for certain illnesses, such as viral infections, actually there can be detrimental impact. So always bring your child to see a pediatrician, okay, if there's fever, especially younger age group. Okay, next topic would be for Dr. Wei Loon. I've not forgotten him. So basically, in terms of myopia, so what's myopia? Myopia basically is nearsightedness. That means rambut jauh, cannot see far, nearsightedness. So I think currently, because of all our technology, children are actually exposed to a lot of screen time. And I'm a parent myself. First one, okay lah, can control. Once the number two come, cannot. I also have to just let them have it sometimes, just so that I can. So with the rise of all this, I think amongst even some of ourselves, we are realizing sometimes the children are needing glasses at an earlier age. So my first question is that, is actually all this screen time, is it the main culprit of children having to wear glasses?
Okay, my answer to this question is a big yes. Okay. Before I actually elaborate further, right? Can you raise it up? How many of the parents here wearing glasses? How many? I can easily say 50% of the audience here. So imagine we are old. We are more than 35, 40 years old, right? But now the kids, if you go into their class, you look into their classmates, how many of them wearing glasses? I can confidently tell you more than 50%. So why is this happening? It's because last time we don't play computer, we always go out, bicycle, play games with friends outside, right? But nowadays, there are so many parents, all right, to make their life easy. One solution, give you iPad and then you will be quiet. I can do my own thing, you play your own thing. So because of this reason, they are so focused and near. What happened is that the eye is not relaxed, all right? So it's always in a focus tension. So all this can actually lead to two common problems. One is myopia, which is what we call near short-sightedness, cannot see far clearly. And second thing is can lead to screen, like what I shared this morning. It can lead to screen. The eye becomes so squinting because when we focus, right, our eye go inside. And when it's too long, the muscle get tired, then the eye will go out. So all this contributing to these two common reasons. So don't actually underestimate the power of this gadget, because these gadgets not to just affect the eyesight, and I believe that it affects the whole body as well, the development of a child. And especially nowadays, there are so many autism. So they just shut their world down and just focus at the world of the computer game or the gadgets game. So as a parent, what we can do is that there are many, many ways to distract the attention of the child, but not just gadget. Engage them with other games that do not need a lot of new works, and try to bring them out from the room and play outside, like what we did last time.
It's great, Dr. Ng. So basically, it's definitely challenging. And although maybe in the past, besides screen time, there are also other factors probably that can affect, getting myopia at an early age. But this is a true problem, that we are having right now. So on that note, how do we prevent?
Okay. So, if according to many studies done in overseas, right, they found out that actually Asian population like what we are tend to get myopia many times higher than those orang putih Caucasians. Why? Because their lifestyle is very different from us. Okay, like we Asian, what we want our kid to be the best in academic, study, go learn drawing, lesson, all this every day, morning until night is all about all this thing because we want them to be the best in academic. That we define them to be successful. All right, but in Caucasian it's different. They go to outside, they play sports, all right? They go dancing, they go to the playground, play with people. Now we keep all our kids at home. Hey, outside very dangerous, a lot of cars, a lot of dust, a lot of diseases, a lot of what do you call it, kidnapper. So we try to keep them in a room, and all this you must understand that one, besides what we have to reduce the screen time, is we have to bring them out. So when you bring them out, reduce the screen time, and also, to mind you, the UV light at about 5 to 7 p.m., that is the best UV light that's good for eyesight. Study has shown that every day, if you manage to get your kid exposed to this period of sunlight or very early morning sunlight, it's actually good for eye at least 2 hours a day. So how many of you can actually get your kid to be out with them 2 hours a day? Are you confidently to do that? I'm sure that a lot of you cannot because you are busy with work, you are busy with other kids and all that. So what we are trying to say is that do your best. Okay, if you can't make it 2 hours, at least half an hour or 1 hour, or cumulative, meaning today I don't do, but then the next day I do. So 1 week cumulative, you can make it 14 hours is the best. But of course, it's not easy. Engage them into sports, swimming, because swimming you are always outdoor, you get sunlight, and jogging, other kind of sports. It's actually good for the eye and also the whole body, not just computer game every day. Yeah. And sorry, may I add a little bit more? It's about if, let's say, unfortunately, your child has developed myopia, okay, meaning you always notice like to squeeze the eye like that to see things, or tend to go near to see things, or the teacher at school say that cannot see clearly anymore at the school, or the handwriting become very large, cannot follow the classmates and all that. So all these are the symptoms. Please go and check. Once they check, you can treat with glasses, all right? So glasses is a treatment, but it cannot prevent the progression, meaning you give glasses, it settle the problem now. It's just like you got fever, I give you Panadol, settle the problem. But the thing is, we do not find out the underlying cause. What is the cause of this? And also, how can I prevent this from happening? So the treatment of myopia or management of myopia is not just give a pair of glasses and settle the problem. You have to settle all the environmental factor, and also at the same time, you have to prevent that. So prevention, we have many methods. We have eye drops, we have special glasses, we have contact lens, we have special red light therapy. There are many methods. But when it comes to all this, the only solution and easiest way for you as a busy parent is that go and see eye doctor. All right, then they will give you a proper advice. What should be the correct treatment tally to your kid? Because everyone has a different power, right? My one is 100, another kid is 600, 700, same age. So we match differently. We do not have a standard protocol for all the kids with myopia. Yeah, thank you.
That's great. So basically, let your kids go and play outside, bring them to playground, bring them to, I think now even what's it called, Gurney Walk or Gurney Bay, very nice, very big space. So, and then we are really lucky, actually in Penang, we actually have the hills, we also have the sea. So, sometimes just take it as an opportunity for yourselves as well, go out, go and enjoy the scenery around Penang. So actually just a very quick one before we move into the Q&A. Do we actually have to wait for our children to have some problems like we notice or they complain? Or actually, do we need to actually bring our children for eye checkup? Because I myself not bringing my children.
Okay, yes. I think, of course, the optimal condition is that you should have your your kids' eye check every year. If, let's say, you think they are normal. The reason why is because the kids cannot complain. They do not know how to say that this is not normal to you. So what happened is that you observe, they behave differently, then only you go and see doctor. So if it's good that if you have the time to bring your kid to have just normal checkup only, just to be sure that your kid's eyesight is normal. I think the best what you call that, the screening period will be every year. All right, no matter how small they are, even they are babies, even they are like toddlers, we have a way to check their vision. All right, so that is one of my advice lah. Even so, if you are worried, you can always bring your kid to see an eye doctor.
So that's great. Recommended is early. If not, sometimes the early signs go and bring your child to the ophthalmologist already.
Start the question for him. On behalf of my patient's parents also. They all wear glasses, myopia and all that. Actually, they come and ask me, do the thing they buy from internet, with the pinhole glasses, things like that, does it actually work?
Okay, thanks, Dr.
And sorry, one more thing is the so-called blue, what do you call that? Blu-ray glasses.
Okay. Yeah, I think this is also a very common question to me. Thanks, Dr. Chiah. I think to answer the first question, the so-called pinhole, you see, you go to Popular, right? You see all these, don't know what, treatment of eyesight, got a lot of holes, all this kind of thing. Honestly speaking, it doesn't work. Okay, don't buy. Because it's just, because everyone, if you have refractive error, meaning you are short-sightedness or long-sightedness also, you put that thing on, you can see things clear one. So it doesn't treat anything, and it's not like you wear long, your power can come down. It's absolutely wrong, okay? So it doesn't work that way, so don't buy that. So the second question is about blue light protection glasses. To be honest, they are not very promising, and how do I put it in the way so that I do not offend anybody, is that I think it may work. Okay, it may work. My keyword is may, but it may not help in terms of the myopia. All right, Blu-ray, in a way, people say that it can cause stress to the photo stress to the retina, which is the nerve layer of the eye. But to me, I don't think it is necessary to have. So instead to have a Blu-ray, why don't you just bring your kid, go out and play? It's free, it's good for you. You also need exercise, right? So yeah, playing with them is a big exercise, I believe. So yeah, just focus on that rather than buying all this hi-fi thing which may not work, and it will not help in terms of the vision. Yeah, that's my point.
So I would like to ask, my youngest son is going to 5 years old soon. So should I bring him to vaccinate the COVID vaccination?
No, okay, COVID vaccine was never available in private because it's a government initiative and government provided. But as far as I know, the government is not bringing in anymore. There's no more COVID vaccine in Malaysia. Whatever stock we have, as far as I know also, is already expired. I have patients who fly to Singapore to get it with the what do you call it, XBB strain. Yeah, I think that's the latest XBB strain. But I don't think many people do that anymore. But I'm no longer sure whether Singapore has it. So then, in a way, we don't see many COVID now. US is still recommended in their CDC guideline. If you see the US CDC guideline, 6-month-old, they actually give COVID vaccine. They probably have it, but we never have it in private. If you request, we can't provide for you.
This question is directed to Dr. Ng or Dr. It's let's say fever. Is the cool fever, that kind of streak, really effective, or it's just a miss? Or then is it putting like cold towel on the head really works? Or is last time our parents that taught us that?
Yeah.
Actually, cold fever is not medicated item. So I don't think, okay, some is for low grade fever, less than 28, probably will help. And is no scientific evidence that cool fever will help to significantly reduce the temperature. And regarding the cold water, so what we call is baby sponging, the sponge the body. Usually what we advise the parent to do is the use of warm water, no cold water. If you want to shower or you want to sponge the body, usually use the warm water, room temperature water. Don't use cold water. Because why? Cold water can cause the body shivering. When they shiver, they produce more heat. And then sometimes the temperature even further will be down. So if you want to sponge body, it's warm water. But again, also study baby sponging is also no scientific evidence can significantly reduce temperature. So that probably it just make the body more comfort. So you know that when the baby or infant they have the high fever, they are sometimes they are bit cranky, they are fussy. So sometimes you need a sponge the body actually with warm water, they feel more comfortable. But for me, for less than 2 months old, I don't recommend baby sponging. Because less than 2 months old with high grade fever, there must be a cause. There must be a cause. There must be a cause whether this child got an infection in some way in the blood, either in the bloodstream or in the one of the organ.
Let's say they are caught, they are down with HFMD or before. Is there anything that can make them less pain or prevent it from getting worse? If let's say they are down with HFMD already.
Okay, so I think it's a good question. So you know that HMB, the children will have some painful ulcer, the oral ulcer. So what we recommend to give is oral paracetamol. That one is not only for the fever relief, but also for the pain relief. But if the pain relief is not getting better, then usually I will recommend to give ibuprofen. Ibuprofen is a safe medication in this disease. But I think if you want to use ibuprofen, you need to be cautious in certain disease. For example, it's proven influenza illness or chickenpox, because there are some case report, children with influenza or chickenpox, all these certain virus disease, if you give, they are associated with some severe brain infection, complication following ibuprofen consumption.
So that's great. I think we can wrap it up. In terms of fever, coming back to it, basically very young babies just bring to see a doctor. Okay. But if they are a little bit older, you want to try again. The concept is if they are well, 1-2 days, you can wait it out. You can try medication. You can try your conservative methods, including even therapy sponging to help them feel better. But if anything longer than the 2-3 days, high fever, or they have other symptoms, not just fever, they have certain other things that affect their condition. So again, always bring them to see their pediatrician. Okay, so thank you very much to our wonderful panelists today for very insightful sharing. And at the same time, I want to thank the crowd because I think you all were really listening well. So we thank you very much for being here with us. So thank you.